A very good morning to one and all. We'll shortly start with our today's session, which is on impression techniques in fixed prosthodontics. Now, impressions in fixed prosthodontics are very critical for creating accurate restorations while doing fixed prosthetic rehabilitations. Now, any impression that you record in fixed prosthodontics has to abide or has to follow these four criteria. One, it should be the exact duplicate of the patient's oral cavity. That is, your final fixed impression should include the prepared tooth surface, the finish line, and all the relevant adjacent areas. Now, when you mention adjacent areas, it has to include the unprepared teeth also, the adjacent unprepared teeth, and also the opposing unprepared teeth to facilitate articulation process. The impression should be perfect, free of any void or any other defect, as any imperfection can produce inadequacies on your impression. It is very important to make sure that you have recorded the anterior teeth, even if the anterior teeth are not the prepared teeth, as the anterior guidance is essential to provide the occlusion while doing a fixed prosthetic rehabilitation. With that in mind, let's move on. Let's see what are the most commonly faced challenges while recording a fixed final prosthetic impression. The first one is moisture or saliva control, as you all might have faced already. The controlling the salivary flow to the prepared tooth or the area of interest is very important to prevent distortion or contamination of the prepared tooth surface. The next major challenge is gingival tissue displacement. It is very important to achieve adequate gingival retraction without causing trauma to the underlying tissues so that you can have good access and visibility to the prepared tooth surface. Now, these are the most commonly used impression materials in fixed prosthodontics. Reversible hydrocolloid, your agar impression material, polysulfide polymer, condensation silicon elastomer, polyether polymer, and addition silicon elastomeric material. Now, the major challenge comes in deciding which impression material to use and when. Or what are the deciding factors? The first deciding factor would be the wettability of the material. What is wettability? Wettability refers to the material's ability to flow easily and evenly and capture the fine details. The next factor which can help you decide would be the consistency of the material. Consistency depends on whether we are capturing fine details or we're just trying to capture the body of the material or whether we are using the material as a tray material. And the last and also one of the equally important factor would be the cost of the material. It is very important that the impression material, the equipments, the tray, all of it comes with a reasonable cost. Now let's move on to the individual impression materials. We'll begin with agar impression material first. If you're planning on working with agar impression material, you need to follow the following protocol. Initially, you begin by isolating the prepared tooth and placing the gingival retraction cord. You transfer the agar impression tray from the storage compartment to the tempering bath for about 10 minutes. You remove the retraction cord. You inject the syringe material onto the prepared surface. Load the full arch tray with the tray consistency material and you temper it. Place the tray inside the patient's mouth and wait for the tray to gelate. And once you make sure that the entire material has gelated, You remove the impression in a snap. These are the different consistencies of the agar impression material. The syringe consistencies for injection onto the prepared surface. And also we have the tray consistency to be loaded onto the impression tray. Next, we'll go through polysulfide impression material. Check the custom tray onto the patient's mouth for tray extension. Then we place the retraction cords. We squeeze out 1.5 inch of the base and the accelerator paste onto the mixing pad. Make sure it's of equal proportion. Scoop the accelerator paste onto the base paste and mix them uniformly back and forth until you get a uniform mix. Fold the mixing pad and fill it onto the syringe. Remove the retraction cord and inject the material onto the prepared tooth surface. You seat the impression tray slowly and gently until it stops. Hold the position for about 8 to 10 minutes. Once the impression is fully set, remove the impression, try the impression, and you can inspect. Next, we move on to condensation silicone impression material. To begin with, apply tray adhesive on the selected stop tray. Take 2 scoops of the base onto the mixing pad. Add the recommended drops of the accelerator based on the manufacturer's instructions. Spatulate on the mixing pad first and then knead them for about 30 seconds. Roll the material onto a cigar shape and place them on the tray. Cover the base with a polyethylene sheet. Place it in the patient's mouth. Remove the impression in a snap and set aside. Now, before you begin with the light body part, you place a retraction cord. Squeeze out the thin silicone base onto the mixing pad. Again, add the recommended drops of accelerator. Mix for about 30 seconds. You dry the preparation, make sure it is isolated well enough. Remove the cord carefully and seat the tray firmly without any downward pressure. Now let's move on to polyvinyl siloxane impression. We'll begin the procedure by painting the custom tray with tray adhesive. Remove the retraction cords. Inject the light body material from the auto dispensing tips. Load the tray and firmly treat it in the place for about 7 minutes. Remove the impression quickly with a snap and evaluate the impression. Moving on to polyether impression. Apply the tray adhesive on the custom tray. Express the base paste and the accelerator paste onto the mixing pad. Mix until streaks are removed and you get a homogeneous paste. Load the material onto the syringe. Remove the retraction cord carefully. Seat the loaded tray in place for about 4 minutes. Let the impression set. Rinse it, dry, and evaluate the impression. Now let's move on to the different impression techniques used in fixed prosthodontics. We have single stage impression technique where a single mix of impression material is used to capture both the prepared tooth and surrounding tissues. We have two-stage impression technique where a preliminary impression is made followed by a second, a more detailed impression. And we also have a closed mouth impression technique. We'll have a word on multiple mix technique first. Here, 2 different consistencies of the same material is used. We'll begin by applying tray adhesive. Then the light body consistency material is injected onto the prepared tooth surface as syringe material. We'll take putty consistency or heavy body is loaded onto the tray material. Light body is also applied over the putty consistency or the heavy body material. The tray is positioned in the patient's mouth. And once it is set, it is removed in a snap. And that shows final impression. Moving on to single viscosity technique. Here, we use the same viscosity, the same material. Only one mix is made. Part of the mix is placed onto the tray, and the other part is placed in syringe consistency for injection around the prepared tooth surface. Mostly we go adopt medium consistency of addition silicone material or polyether material can be used in this technique. Moving on, we'll go to putty wash technique. Here again, we record putty material is used for the initial impression, followed by a wash material for the fine details. We'll take equal proportions of the base paste and the catalyst paste in putty consistency. Mix them uniformly until you get a uniform color. We'll mix the impression, and also at the same time, we'll dispense equal proportions of the light body, base paste and catalyst paste, and you apply it as a wash over the initial putty impression. Let's also have a look at closed mouth technique. Now, this is performed with the help of triple trace, where you can record the maxillary and the mandibular impressions simultaneously. Now, let's just a word on troubleshooting as well. Make sure any impression that you record has satisfied the following criteria. The impression material should be uniformly, homogeneously mixed. You should have applied the tray adhesive uniformly and thoroughly. The impression tray should be rigid or sturdy. There should be no voids or pulls on the margin detailing. There should be detailed margins with no tears or rough surfaces. No burn through of heavy body material. Strong bond between the heavy body and the light body material. There should be no interface or no separation that is obvious. There should be a strong bond between the impression material and the impression tray. There should be no tray separation. And there shouldn't be any tooth contact with the tray. That is, there shouldn't be any tray exposure. Always keep in mind, an impression should be in the mind of the dentist before it's in his hand. With that, I would like to conclude this session on impression techniques in fixed prosthodontics. Thank you all for your patient listening. Thank you.